Hello folks, I'm Dr. Jason Young from Body of Health Chiropractic and Wellness Center, and what I've done is I've put together a series of videos that are actually an interview that I did with a friend of mine, Stacie Dodson, and I'm going to be posting them over the next few days throughout the week so that you can get the whole thing. I just figured nobody wanted to sit down and watch for an entire half an hour, and so we've kind of cut them up into little segments. We're going over some frequently asked questions about nutrition. That's a field that she's into and I'm into as well. In this first segment, we're actually covering two questions. Number one, I eat healthy, do I still need supplements? And number two, why doesn't my doctor recommend supplements? So watch the video, enjoy, and comment. Feel free to share it. And yeah, I just told you what to do. So now, do it. Hello everybody, I'm Dr. Jason Young from Body of Health Chiropractic and Wellness Center. And today I have Stacie Dodson. She's a consultant with Isagenix. She's also really super smart. She is the head chief guru of CME at the local hospital here. Is that right? Or am I making stuff up?
Exactly.
Okay, good. All right. Super. So I asked Stacie here because she's somebody that I respect. She's smart as a whip, however smart a whip is. She's at least that smart. And but she knows a lot about nutrition, and she helps people with nutrition. And so I like nutrition too. And so we wanted to get together and discuss some of the frequently asked questions that we get from patients and clients and things like that. So I have a list of about 6 of them that are real questions that we get from people. And so we'll just kind of run through them and discuss what we think, because our opinions are right all the time. Ready?
Yes.
Okay. So Stacie, here's the first question. Are you ready?
Yes, I am.
Okay, brace yourself.
All right.
Here it comes. I eat healthy. Do I still need supplements?
Long story short, yes.
Okay, good answer. I also say yes.
The reason being is because most people's idea of eating healthy varies wildly depending on their background in nutrition. Also, our food supply is getting less and less, nutrient dense. For example, an apple from 1975 has 40% less vitamin A than it does now.
So shouldn't we just build a time machine,
go
back and get some of those 1975 apples
Yes.
and just bring it back?
Yes.
Wouldn't that be easier than taking supplements every day, right? So.
I wish, but yes, so it's important to fill in the gaps nutritionally that you're not getting from the fruits and vegetables that you're eating on a day-to-day basis.
Cool. I think that's a really good answer. And one of the things that I'm often telling patients is, you look at the word. So a supplement is not the main meal.
No.
It's something additional that you're adding to what should already be good nutrition. And so supplements, basically they're useful. I recommend them to people all the time. I know that you recommend them to people, and we don't do it just because it's fun. We do it because it makes a difference in people's lives. And so the proof is kind of in the pudding, so to speak. Not saying that you should go out and eat a bunch of pudding. But there's sometimes when a supplement is exactly what you need. For example, if you are short on vitamin D, take one. Vitamin D is one of my favorites because it covers a broad range of things. But if you're short on vitamin D, you're going to have things like depression, you're going to have pain, and things like that. And if that is your problem, is that you're short on vitamin D, there's no amount of salad that's going to fix that, and there's no amount of driving past McDonald's that's going to fix the fact that you're short on vitamin D. You know what does fix it?
Supplements.
Vitamin D, yeah. And so supplements, even if you're eating healthy, they can still be necessary because our like you said, our food system is kind of messed up, and it's not just about the produce that we grow, but it's about what's available too.
Mm-hmm.
What's available in the grocery store, and also what is the most enticing food out there, because these days people want to eat what's easy, what's available, what tastes good, and that trumps in their decision making what's really, really good for them. So yeah, what is healthy?
It's very true. People don't realize also that if they're deficient in one major mineral or even some micronutrients, that they're not absorbing the other ones that they are intaking. For example, vitamin D and calcium, vitamin C and iron. there's interconnectivity between all of those, that if you're not getting enough of one, you're not going to absorb the other as well. So it kind of creates a domino effect.
Right, that's a really good point. Magnesium is a really common one like that. And so if you're supplementing and you're eating a healthy diet, I really think that that's optimal. And so a question like this makes me think that there's some people that want to only be so healthy, right?
Right.
It's like, if I could be 100, I just want to be about 75, because that other 25% is where all my happiness lies. I don't know what it is. So, all right, what about this one? Why doesn't my doctor recommend supplements? Like, so if they're useful, why isn't, like, when I go to my medical doctor, why aren't they saying, oh yeah, take these supplements?
Well, I think that depends on the doctor that you're going to. Traditionally, Western medicine has been more reactive than proactive. I think that's seeing a huge shift right now.
I hope so.
And so taking a supplement is definitely a preventative health measure rather than a reactive health measure. So unless you're going to the doctor and complaining of maybe low energy, they may test you for anemia and recommend an iron supplement. But I found that my last few visits, they've actually recommended to take a woman's daily health, vitamin, and encourage that as part of your overall wellness. So I think it kind of depends on who you see and why you're going there.
That's fantastic. And so maybe that's like an important question to ask whenever you're shopping around for a doctor. And if you buy what Stacie and I are saying, that, a supplement every now and then is good, then you might want to, as you're doctor shopping, ask, how often do you recommend that somebody takes a vitamin? And if that doctor's thinking doesn't really align with yours, then, there you go. But I think maybe one of the main reasons that a lot of doctors don't make that recommendation is just because of the way that they were trained. Mm-hmm. Everybody likes to say, oh, well, I practice science-based medicine or evidence-based medicine. We go off of the best available evidence. Well, guess what? Like, from the time we started this video to right now, there's more evidence out there. So it's really tough for doctors to keep up, as you know, with what you do. And even when doctors get that information, they still practice the way that they were originally trained, because it's comfortable. Right. And people like to do what's comfortable. And so there's not a lot of doctors, in my experience, that are really comfortable with a nutritional intervention or recommending a supplement or something like that. I think a great example is you look at things like mammogram guidelines. I had a friend who...
Very controversial right now, by the way.
Yeah, right? And so she told me, well, I finally hit that age, and so I've got to start going in to get my annual mammogram. And I said, oh, you're getting an annual mammogram. Then you must be seeing somebody who has a new mammogram machine. She said, really? Why? I said, well, because they've got to pay for the mammogram machine. That's why they're recommending that, because that's not the guideline. I mean, there's some thought that mammograms might cause as much cancer as they're detecting. And so, that guideline changed, and it changed in 2015.
It also depends on the specialty.
Yes.
What they recommend. An OBGYN, a family medicine doctor, and an oncologist and radiologist are going to have different ideas on that same recommendation.
Right, right, exactly. And a lot of it just has to do with, how were you trained? Mm-hmm. And so, I admit that as a chiropractor, I have a lean more towards supplements because, part of the reason is because chiropractors don't prescribe medication. And so I can't prescribe something else. But it's part of the reason I became a chiropractor is because this jives with my personal philosophy. And so, but you're right, I do know some medical doctors that will recommend supplements whenever patients come in and they're like, oh yeah, I'm taking a probiotic and vitamin D and fish oil. And I'm like, oh really? Like, why are you taking those things? They're like, because my doctor said so. I just want to hug them. And then I want to call up their doctor and get them on the phone, and then I want to hug my phone. And so, it's really a great thing. But have you ever come across any doctors who are just like hell-bent against them and they're like, it's a scam, it's all a scam?
I haven't run across any ones that are hell-bent against them. Mm-hmm. I think a lot of it is, like you said, about training. In medical school for nutrition, they're only given about 2 to 3 weeks generally of training on nutrition. It's not their focus. Mm-hmm. And so people, I think, rely on physicians to give them a lot of recommendations that they're not necessarily well versed in, because they have to know so much about so many different things. Nutrition kind of takes a sideline.
Right.
But generally speaking, I think if people are having energy issues or sleep issues, I think more and more often physicians are recommending that they do look at supplements.
So you're saying that if I have sleep problems, it's not because I have like some sort of Ambien deficiency or something?
Exactly.
Yeah, tested your blood levels for Ambien, and you're really, really low. So hopefully you enjoyed that segment of the video. Again, comment, feel free to share. Hopefully you appreciated this video. Tune in again for our next segment. Like I said, I'll be posting these over the next few days. If you want more information about my business or how to get in touch with me, you can go to yourbodyofhealth.com. Otherwise, if you'd like to get in touch with Stacie, you can search for her on Facebook. Just search for Stacie Dodson. That's Stacie. Dodson is Dodson. And feel free to like her page, follow her. She's got lots of great information. Again, thanks for watching, and we'll see you in the next segment.